Good afternoon, everyone. I am Varsha Srivastav from Bladder Wellness Team. I hope you all are keeping well. Please vaccinate yourself and wear a mask when in a public place. Today we are here to talk about overactive bladder or urinary incontinence. Urinary incontinence is a sudden urge to pass urine, which is difficult to control. The condition is common and distressing and may have a huge impact in the quality of life. So, in this month of World Continence Week, let's unite to raise awareness about incontinence related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what is right for diagnosis and treatment of urinary incontinence, today we have with us Dr. Kapil Thakkar sir. It gives me an immense pleasure to introduce Dr. Kapil Thakkar sir to you all. Dr. Kapil Thakkar is a senior consultant urologist at Excel Hospital, Surat. Sir has a rich experience of 20 years in the field of urology and carries out the treatment with utmost precision and efficiency. Sir, we are pleased to have you over here. We welcome you in our show.
Thank you so much.
Yes, sir. There are many questions that our viewers would like to know. So first, I'll start with what is urinary incontinence?
Okay, now urinary incontinence is, as you just said, it's a sudden urge to pass urine. So what happens is you have a sensation to pass urine, but you are unable to reach the washroom. So the urine starts leaking in between. That is called incontinence. Basically, continence means the control. Incontinence is uncontrolled. So any leak of urine which is not in your control, that is called incontinence of urine.
So, sir, what are the types of urinary incontinence?
Okay, now see, there are there are three types of urinary incontinence. One is urge incontinence. Urge means you have a sensation to pass urine and you cannot hold that sensation. You have to immediately rush to the loo and you leak urine in between. That is called urge incontinence. Urge means you have an urgency to go and then you can't stop. You can't hold it. That is called urge. Second is stress incontinence. Stress means you are doing any exercise or maybe jumping or laughing or sneezing or something which increases your abdominal pressure. That is called stress. And now what happens is in such case, if you are say jumping, you're skipping ropes or maybe laughing or even sneezing, you leak a lot of urine. That is called stress incontinence. Now this is very embarrassing and it you go to socially and it becomes a taboo that you leak urine while you are laughing or something.
Yes.
And third incontinence is overflow incontinence. Overflow occurs when what happens is your bladder gets full. So imagine a tank is getting full and then there is overflow of the tank. Similarly, your bladder gets full beyond its capacity. It can stretch up to a little furthermore, but beyond that, the urine goes, the water will find its way. So urine starts leaking after that. That is called overflow incontinence. So these are the three types of incontinence.
Okay, even stress is one of the biggest factors that contribute to urinary incontinence. Okay,
Correct.
So who are more prone to this disease, male, female, or elderly patients?
Yeah, see, basically, all these incontinence, females are more prone to have incontinence of urine, and they have this urge as well as stress. Both are quite common in females, and overflow incontinence is little common in male because they have prostate. Now, prostate is a male organ which occurs, which is there at the mouth of the bladder, and it can cause obstruction as the male ages. So beyond 50, that can cause obstruction. And that can lead to a lot of urine which is holding, and that can lead to incontinence. Also, it can occur in neurogenic conditions. But all in all, females, especially elderly females, are more prone to have this stress as well as the urge incontinence.
Elderly patients and male and female both can have it. Once
Absolutely.
The chances are okay. So, what are the food items actually which we should avoid in order to save ourselves from urinary incontinence?
Yeah, see, food does have some role to play. It's not, I mean, patients keep on asking me, what should I take care that I'll get rid of this incontinence? It's not always related to the food, but you do need to keep care of certain foods. Like you should have less of citrus fruits. Sometimes that can cause irritation. Smoking, alcohol, caffeinated drinks, carbonated drinks, Coke and all. These all will act as bladder irritants. So they can cause a lot of irritation. They can cause a lot of frequency and urgency of urine. So especially the patients who are suffering from incontinence, overactive bladder, all these patients we do advise a lifestyle modification. And one part of the lifestyle modification is this diet which you mentioned. So diet, they do have to take care. One is they have to restrict fluids. They don't have to drink. Some people are compulsive over water drinkers. They drink 6, 7, 8 liters of water. So they have to reduce that. So you have to be in moderation. And especially alcohol, tobacco, caffeinated drinks, all these, and even spicy food, these all will act as irritants. So these all things have to be reduced in your consumption.
So especially when you drink alcohol or you smoke, you have to be extra careful because there are many
Absolutely.
side effects. And one such side effect is this urinary incontinence. So you have to be really careful with that. Okay.
Correct.
Sir, at what stage do we get to know that we have urinary incontinence and we should consult a urologist? How should we identify it?
Yeah, see, what happens is we have in our society, there is a big taboo about this urine. People don't come forward with the problems. Initially, they may have a little bit of leak. I have so many elderly patients who think that as we age, we leak the urine. That is normal phenomenon. So that has gone into their psyche, but it should not happen. They should come forward, even at the slightest amount of urine leak, they should come forward and seek consultation of a urologist. Because then sometimes this may just be a symptom, the leak of urine, but there may be some underlying problems which will come forward. So you should not ignore it at any stage. Even at minute incidences of this leak and urgency, all these symptoms have to be addressed too. It may not be just symptom. You may have enlarged prostate, even cancer of the prostate in the males, or even females may have sometimes what happens is even the bladder cancers, the cancers of the bladder, at initial state, they will just cause frequency of urine. So it's always better to get yourself checked up by urologist, and who knows, something might come up and you get an earlier treatment, it always can give you a cure. Whereas later you may not find a cure for that.
Okay, that is there. Whenever you're feeling like that something is leading to urinary incontinence, at that very moment you have to consult a urologist.
Absolutely, absolutely.
Many people, what they do, they just Google and they try to find the solution by themselves. So what would you suggest to these people?
Yeah, that is very harmful. Googling all and doing all, there are a lot of advices given by so many people. In India, they say every third person is a doctor. First, especially in our profession, we are dealing with kidney stones and all. Yes. So I always encounter patients who usually they will have treatment from some either some quack or some relative that ye phalane pan le lo, then take this, drink this, you will pass your stone. So these things should be avoided because that can harm you. And you should not be afraid to seek opinion. See, nobody will directly give you surgery and all these options, costly options. If it's treated with medicine, maybe we don't treat even with medicines. With just lifestyle modification, you might benefit. So no need of being hesitant to go to a doctor. You should seek a correct medical and scientific advice for it.
Yes, that is there. We must not become a doctor by ourselves. We have to consult.
Correct. Absolutely.
Yes, sir. So now we have started getting questions from our viewers. So I'll take the question one by one.
Okay.
This question is by Deepak Upadhyay. He's asking, does overactive bladder leads to UTI?
Overactive bladder doesn't per se lead to UTI. So UTI is a different entity, but UTI can definitely cause overactive bladder. It may be the other way around.
Okay. So other way around is the answer for this. Okay. Yeah. Next question is by Mohammad Rafiq. He's asking, are there any food or beverages that should be avoided? Like if you want to get rid of overactive bladder?
That already I answered you. Just avoid the irritants. And over time, you will come to know with what food you are not comfortable. Some people don't tolerate cheese very well. Some people don't tolerate citrus fruits, spicy foods. All these things have to be avoided.
And in India, we do eat spicy food. So
yeah, a lot.
That should be avoided. Okay.
Yes.
So from this question itself, there's a relatable question. What food items should we include in our diet? That will be helpful.
See, food items, overall, I would say you should eat a healthy meal, which should be a balanced diet, and it should be nutritious as well,
Hmm.
and with adequate amount of fluids. Don't over drink or don't under drink.
Hmm.
Under drinking water can lead to stone disease, and over drinking can lead to overactivity. So you should be there should be a balance, and there should be good mix of proteins, carbohydrates, and fats, and it should be a balanced, nutritious diet. That's it. Don't drink, and especially outside foods and these spicy things and all should be avoided to prevent this.
A balanced diet is a must for a healthy lifestyle and if you want to be healthy. Okay.
Correct.
Yes, sir. What is the treatment for this urinary incontinence?
Okay, now see, today I think we'll discuss more of the overactive part of the urge part, because, and I'll give you a brief treatment about the stress as well.
Hmm.
Now, first talking about the overactive bladder or urge incontinence. Now, first let me tell you overactive. What is overactive bladder? Basically, overactive bladder is there is a bladder, the urinary bladder. Basically, the bladder is a bag which stores urine, and when you feel like passing urine, the bladder will contract and you will release urine. So that happens when you find proper time and place to empty your bladder. You go to the washroom and you can empty out. But in overactive bladder, what happens is the muscles of the bladder, they become overactive. So even before the bladder fills completely, they start contracting. They produce these contractions. And these contractions can lead to urgency and urge incontinence. So that is overactive bladder basically. Now coming to the treatment of the overactive bladder, first I would like to say how to evaluate overactive bladder. Just 2 lines on that. Now a patient comes with overactive bladder. First, history is very important. You take proper history, whether he or she has urge incontinence or stress incontinence, how is the urinary flow, all these history taking is very important. After that, there is a physical examination. Physical examination, we see if there is any bladder which is full, that is palpable, that may be an overflow incontinence. Apart from that, we check prostates in the elderly male, and female we check and see if they are leaking on coughing or sneezing. If they give a cough and they are leaking, that means that is stress incontinence. So these are basic things which a urologist does, takes history and does physical examination. And then we prescribe certain basic tests. One is to rule out urinary infection. We do some urine routine and all. And one basic other test is sonography, ultrasound of the abdomen, to see if he or she is keeping a large amount of urine behind and that is the cause of the leak. So once all this workup is done, then we focus on the treatment. Now, treatment exactly doesn't mean treatment means surgery or medicine. No. Overactive bladder, the treatment starts with lifestyle modification. That is number one. So lifestyle modification means, as we just mentioned, healthy and nutritious and balanced diet and fluid management. Fluid management, not to over drink water. Don't be a compulsive water drinker. And apart from that, avoid the irritating foods which which can likely cause this. Maintain a healthy lifestyle. Reduce your weight. Keep the weight in check, and do regular exercises. So all these things, especially some pelvic floor exercises are prescribed, then that can also help in this incontinence. So this lifestyle modification is number one. And with just lifestyle modification, many patients improve just like that without taking a single medicine. So these patients can just be treated by lifestyle modification. Now, after, if the patient doesn't improve, or if he or she has a little higher incontinence, then you can't just treat with lifestyle modification. You have to add certain medicines for it. So certain medicines are available called anticholinergic or antimuscarinics. And now latest drugs are called, which are beta-3 agonists. So these drugs, they will reduce the contractions of the bladder. So basic mechanism was your bladder contracts and you have to go immediately to the washroom and you leak in between. So these medicines, what they will do, they will reduce the contractions. So the by reduction of the contractions, you will get adequate time to reach to the loo, and you will not leak urine in between. So that will improve your confidence. That will socially you will be more acceptable, and you will lead your quality of life will improve with that. So these basic drugs can be done, and then you can. There is a play of drugs. Certain drugs, maybe patient cannot tolerate one drug, then you change to other. You may add combinations. So lots of things are available. These permutation combination things are there. So then drug treatment. Third is we ask the patient to maintain a bladder diary. Now, what is a bladder diary? Bladder diary, the patient has to write for 24 hours how much water and fluids he or she takes. Like suppose a glass of cup of tea, so 150 ml of tea I have consumed at 6 a.m. 7 a.m. I have taken juice 200 ml. So that's for just one day. He writes the entire amount of the fluid taken during the day, and every time whether when he goes to the washroom, how frequently he goes, and preferably to measure the amount every time. And third thing, whether there was any leak or urgency. If leak was there, then yes. Urgency was there, yes. So by this bladder diary, we get a whole lot of information, what type of incontinence is there, and whether he or she will benefit medicines or what. So once all these things are done, we start medicines. We review the patient again after a few days, because these drugs are also having some side effects. These anticholinergics will have dryness of mouth, constipation, certain side effects are there. So we call the patients back and see how they are, whether they are taking the medicines properly or not, how much they are benefited. And then depending on that, either we continue treatment for a little longer duration. Usually these patients will require treatment for about 2 to 3 months maybe. So you continue with that. Now, suppose there is no benefit with medicines, then you either increase the dose, make some combinations, and still if it doesn't happen, then there is an invasive treatment, that's the surgery. So that treatment comes, that is called Botox injection. That can paralyze the muscles, so your bladder muscles won't contract. And then comes the role of surgery.
So there are many treatments in urinary incontinence.
Absolutely.
Even you can exercise and help yourself, and medication is there, bladder diary is there, and if nothing is working, surgery is there. So many things are there. So there's nothing to worry about it.
Absolutely.
Sir, how much percentage you can say, like, is this disease really curable, or still there's a long way to go?
No, see, we have made a lot of developments over the past few years. There are, as I said previously, only anticholinergics were available, which have a lot of side effects like constipation, dry mouth, and patient won't tolerate that drug. So simply they used to take 2, 5 days and they stopped on their own. So now these latest drugs have been developed, beta-3 agonists, which have the minimum side effects. So patients can take them properly, the compliance is good. Secondly, this Botox and things have come. These are minimally invasive treatments. Previously, what was to be done, like we used to do an augmentation cystoplasty. We created a bladder, increased the capacity of the bladder by putting some intestines on top of it. That used to be a major operation. So with these Botox and all these things, it can be avoided. So a lot many developments have happened, and there are still many research which is going on. And patients, they have a lot of many options to get rid of the problem.
The best part over here is that medicine and even science is very advanced, so you don't have to worry about it. If there is a problem, there is a solution. Of course. Sir, is this disease only found in elderly people, or even children are also prone to this disease?
Yes, children do have it. Children also have it. Adolescents have it. Many people, younger people, younger females especially, are prone to overactive bladder. So they do have it. Children also have overactivity, but children may have overactivity due to certain underlying cause, like either some neurogenic cause or maybe a valve, posterior urethral valve. Some certain things can happen, and that can lead to overactivity. But yes, children do have. I see many patients, many of my pediatric patients do have this.
But as compared to elderly patients, the numbers are less.
Quite less, yeah.
Yes. Okay. So even for children also there is a solution. Obviously, it is treatable, of course.
Correct, yes.
Okay. Sir, what are the chances of urinary incontinence in a pregnant lady?
Yes, it does happen. See, pregnancy, the one more thing is the uterus gets enlarged and it compresses the bladder.
Yes.
So there is one more cause that can lead to irritation, and that can lead to frequency. So pregnancy, also there is overactivity, but your pregnancy is one condition where you would not like to give too many drugs, because if the harm it can cause to the baby. So we don't prescribe a lot of many drugs. We just tell them to modify the lifestyle, and with little bit of counseling, all they'll do well. Because as soon as the uterus, then after delivery, it becomes smaller, so the symptoms may go after that.
So even pregnant ladies can have it, but there is a treatment for that as well. Okay. Sir, you have mentioned in the diet chart that the intake of caffeine leads to urinary incontinence. So the person should completely stop drinking coffee, or he can have 1 or 2 cups of coffee in a day.
See, that depends. I myself have 2 or 3 cups of coffee, so that's all. That depends on how much your body is tolerating. So need not completely stop it, but you can reduce your intake. Suppose somebody is taking 4 or 5 cups of coffee, I would advise go slow. Maybe take 1 cup and see how you are. And still, if the incontinence doesn't, it doesn't improve, then you have to stop it then.
Yes, yes. So the same thing applies to drinking tea as well, because
Yeah.
we Indians, we drink a lot of tea. That is
Yes. Correct. Absolutely.
Even just 1 or 2 cups are okay. Excessive fluid obviously will lead to urinary incontinence.
Yes.
How much water intake, like drinking water, how much liters you would like to prescribe to all our viewers?
Yeah, see, I can't make a generalized statement because see, now some patients they are stone formers, they are recurrent stone formers, they form stones, kidney stones. So for them, I would like to advise more fluids. Some patients are prone to develop incontinence, and such patients I would like to reduce. Similarly, the patients who have cardiac ailments, like their heart is weak, or maybe the kidneys are weak, then such patients can't drink a lot of water because the kidneys or the heart won't be able to tolerate such a big load of water in the body. So such patients have to reduce. Even the kidney patients, suppose the kidney function is not good, they have to reduce to just 1 liter a day.
Yeah.
So that is a little personalized thing. But all in all, I would say 2.5 liters is good enough intake for a normal healthy 2.5 to 3 liters for a normal healthy adult.
Even the intake of water depends from patient to patient. So before making any decision, please consult a urologist. Then you will get a proper advice. That is there, sir. Okay, sir, taking the next question, and it is by Ankur Prakash. If someone is leaking urine during laughing or sneezing, does it belong to urinary incontinence?
Yes, it is. That is what I was talking about. That is called stress incontinence. Now, I forgot to talk about the treatment of the stress incontinence in my previous answer. Now, stress incontinence can be treated. Initially, you can treat with just Kegels exercises. They are the pelvic floor exercises. With that, what happens? Your pelvic musculature increases, it strengthens, and that can reduce the leak. Now, with just pelvic floor exercise, if that doesn't cure, or the leak is in too large a quantity, then there is a very simple operation called, especially in the females, we do this. That is called TVTO. It's a transvaginal tape. It's just a tape which we do, and the tape will form. It will form a hammock. It will form a hammock across the bladder, and that will cause a lot of fibrosis, and artificial muscle-like thing will develop over time. So with that, that leak will stop. So that is a very nice and simple surgery which is available
for stress incontinence.
Yeah.
That is a new thing, like, because nowadays we people, everyone takes stress a lot.
Yeah.
So because of this, urinary incontinence is possible. Okay. So taking the next question, and it is by Manoharan. He's asking if I take a COVID vaccine. So if I take COVID vaccine, do I need to stop taking urinary incontinence medicine for that particular duration?
No, you can go ahead. You can take it. No need to stop.
Because of COVID, many lifestyle changes have come, and coronavirus has a huge impact in our lives. So, what would you like to suggest to such people who have urinary incontinence and they have got COVID?
I mean, you're asking me about the vaccines or the patients?
No, the patients who have urinary incontinence issue and they even got COVID.
Okay, then no problem. They can continue taking the medicines. There is no issue on that.
So I think Manoharan, your this answer is clear. You don't have to stop taking the medicine. You can continue with that. Okay. Taking the next question, and it is by Radha Krishnan. He's asking, are there any lifestyle changes that we need to take in order to manage overactive bladder?
That we already discussed. Now, lifestyle means you have to, one is the diet aspect. Second is the weight reduction. Third is proper food, nutritious diet, balanced diet. Fourth, what you can do is one more thing which is available called bladder training. Bladder training. Now, what happens is bladder training means you have to, it's a sort of an exercise. You play with your bladder. Once your bladder starts getting full and you feel like passing urine, you just count 10 to 1 or 1 to 10 and allow that urge to pass away. Then again, you may have second time, again you do that. So that urge lasts only for a few seconds. Once that urge passes away, then you are fine with it. So this is called bladder training. You have to train your bladder. This is one more thing which the urgency people can do.
Bladder diary is there, bladder training is also there. So this we can do, and we can just try to find out how much urine we are leaking. Okay. So all these questions we have taken. Another question. Okay. It is by Sabri. Does diabetic patient also have urinary incontinence, or the chances are less for the diabetic patients?
Diabetic patients have got a higher chance of having this because the bladder, they do have it.
Okay, so if you have diabetes, so the chances are more. Sir, how do we overcome with that if we have diabetes and we have urinary incontinence as well?
See, basically, the treatment will remain same. Apart from the thing that you have to take care of your diabetes, you have to control your sugar levels properly, and you should prevent infections of the urine, and just take care of the routine diet, weight reduction. All these things you take care. That's good enough. And only if the incontinence is significant, then you have to start on medicines. Otherwise, no.
Okay. So taking the next question, and it is by Varun Jain. Does dehydration cause incontinence?
No, dehydration won't cause incontinence because there won't be urine to leak if you are dehydrated.
So you have to drink plenty of water as prescribed by the urologist. Dehydration does not cause incontinence. So this answer is clear, I hope, to our viewer. Another question, and it is by Shivani Mishra. Can certain medications and pelvic or abdominal surgeries cause overactive bladder?
See, generally, surgeries won't cause any overactive bladder. But yes, some surgeries which are, a major removal of organs or something, these surgeries can lead to damage of the nerves which supply to the bladder. And that can lead to not urgency, but that can lead to, underactivity of the bladder, not overactivity. And that underactivity can lead to overflow incontinence because your bladder gets full and then you leak by an overflow.
Okay. So this answer, I hope, is clear. Okay, sir. So we have taken almost all the questions. Sir, what would you like to advise to all our viewers regarding urinary incontinence? Because there are people who even get panic when they see that they have an involuntary leakage of urine. So what would you like to advise?
Yes, see, it's a very big, your quality of life suffers a lot if you are having incontinence. Yes. Imagine you are going to a party or you are socializing and you are leaking urine. So this gives a lot of impact on your quality of life. So definitely you don't just ignore the problem because now it may be little, then over time it may grow. And then sometimes the treatments may not be good after some time. So you need to, first of all, you should, if you are having this incontinence, you should consult a urologist once at least. Let him evaluate why you are having incontinence, what is the cause, because there are many underlying causes as well. So once you see a urologist, don't self-treat. That is the second advice. Don't start medicines on, because you get a lot of medicines on this 1 mg and all, online people started. But don't do all these things. You properly consult a doctor, let him evaluate your things. If any test he advised, do undertake all those things. Then whatever advice he gives, like lifestyle modification, fluid management, follow all those advice. And then see, this may take a little longer, but don't get, restless. It may take a little longer time to get treated. So follow proper advice and then you should get rid of it eventually.
Okay. So you have to be patient enough because it takes time, but it is curable. Okay. These and all questions we have taken. Sir, one more question. Does yoga and meditation also helps in order to get rid of urinary incontinence?
Yes, definitely. It's a part of lifestyle modification. You should have yoga, relaxation exercises, all these things, meditation, that will help definitely.
Okay. So when you are having a healthy lifestyle, when you're doing yoga, when you're doing meditation, so obviously it will help you. Okay, so we have answered all the questions of our viewers. I hope the myths are also clear regarding urinary incontinence. What is urinary
I will.
incontinence causes, and everything is clear. Okay, so thank you so much, sir, for your time.
Thank you.
In the end, what would you like to say to our viewers?
See, nothing but not. If my only advice is you don't self-treat, take proper care of yourself, and don't live a stressful life. Just relax, enjoy your life, and live a healthy lifestyle, and consult your doctor whenever you need it. That's it.
Okay. So, with a proper consultant from a urologist, you will get the solution to this problem. So, there was a problem and there is a solution. So, this is for all our viewers. You don't have to worry at all because the urologists are always there for you. Thank you so much, sir, for all
Thank you
your
so much.
advice, guidance, and for taking out time to come in this live and give all the benefits, all the feedbacks regarding your urinary incontinence, the problems, and everything. Thank you so much, sir.
Thank you so much. Thank you.
And thank you to all our viewers for being so patient and asking all the questions. I hope all the questions have been answered. You can follow us on our FB page. It's by Bladder Wellness. You can follow us on YouTube, Instagram, and Twitter by the name of Bladder.